Welcome, welcome, everybody. It is great to have all of you join us here today. I'm Michelle Hayward. Today, we're talking about how employers can protect employees' reproductive health. I have a fantastic guest here with us today, and I'm excited to introduce her. Her name is Flory Wilson. She is the founder and CEO of Gender Ideal. Gender Ideal is a nonprofit focused on creating gender equitable workplaces through data driven performance insights and recommended actions. Flory has over 20 years of experience creating equitable and sustainable organizations around the globe. She is passionate about using data and real world examples to inspire, create change in business norms that provide tangible benefits to key stakeholders. That's from employees to the environment and consumers. And she's doing this by activating business leadership, ownership, and investors. In the last few weeks, Flory has put together the Pro Repro playbook, and she's going to share that with us today. Flory, thank you so much for joining us.
Thanks so much for having me, Michelle. I'm really excited to be here and to be having this conversation with you and your network.
I'm excited too. So, let's start a bit about and discuss a bit about gender ideal. How did that come about? How did you get started? And then we'll get more into the specifics of today's topic.
Yeah. I started Gender Ideal about 2 years ago. Actually, it coincided with the beginning of the pandemic, ironically, right? Because after spending, 15 years working in first international development and then focusing on growing the B Corp movement and scaling the impact investing movement by providing measurement and evaluation tools for entrepreneurs and for investors, I decided to pivot to a topic that has always been near and dear to me. I remember in 1980 going to an ERA rally with my mom and my sister and being keenly aware from a young age about the ongoing fight for equality for women. And so after being in the workforce for 20 years, I thought, gosh, you know what? There's still a lot of progress that we need to make to create kind of institutional norms that really focus on creating gender equitable work environments. We think about that we do that looking at it through an intersectional lens. So really thinking about what are the specific needs of women of color, women of different sexual orientations. And then of course, when we found out back in early May that the Supreme Court was likely to overturn Roe v. Wade, which has been the law of the land my whole life, I found myself really thinking about the role that business is going to play and should and needs to play, and the leadership business needs to play in protecting reproductive health access for all women. And so I've been really focused on this issue now for the last couple of months. It's core to everything that we care about and want to work on at Gender Ideal.
Thank you so much for sharing more about Gender Ideal. Definitely focus here at Positive Hire on gender equality through the lens of underrepresented women. So definitely a lot of alignment, which is why I invited Flory to have this conversation here. I'm going to turn it over to you to go through your playbook because, like you said, companies, employers are part of this. And they're often stuck with, I don't know what can we do, what should we do? And your playbook really shows them the actions they can take and why they should take them. So I'm going to turn it over to you to go from here. Thank you so much, Flory.
Great. Thanks. And thanks for pulling up the slides. And I would just say, again, for folks joining on LinkedIn, please chat in questions. I want to make this as interactive as possible and as helpful and actionable for you all. So please don't be shy. I will be checking the comments and love to be interrupted as I go. So I'm going to skip over this first slide. I already talked a little bit about Gender Ideal and the fact that we have tools and assessments and resources for companies to think about how they can structure their organizations through the policies, practices, and policies to be as equitable as possible. We kind of hold as our North Star what we've distilled into our 3 gender ideal goals. And, these again are really focused on equal opportunity, unbiased work environments, supportive systems that allow people of all genders to achieve their maximum potential in the workforce. And so when the ruling, or I should say the leak about the ruling, dropped in early May, I found myself really thinking about the interconnectivity between reproductive health access, the economy, labor, and business. And so what you can see on this slide are a lot of different data points that I pulled together based on research that's been conducted in the last years and even really over the last couple of decades around everything from workforce preferences around working for companies and being located in states where they have access to the full suite of reproductive health services, and working for companies that are aligned, right, that have kind of that values alignment as part of their core business values. Really interesting data that shows that consumers have a preference for buying goods and services from organizations that, again, that have that kind of same values alignment. And then, again, very interesting data. And I want to just give a shout out. Actually, let me say 2 things. One, all of these stats that you see on the slide here, I didn't include source citations for obvious reasons, right? The slide's really crowded. If you go to our website, www.protectreproductivehealth.org, you'll see all of this data as well as the sources it came from. So groups like the Guttmacher Institute, RIA Ventures. I also want to give a shout out to a fascinating study called the Turnaway Study, which has been tracking women in the United States who were turned away from seeking abortions for a variety of reasons, and then tracking those women and their partners and looking at the medium and long-term economic, health, income, socioeconomic impacts of not having access to abortion services. And so the takeaway from this data is that there's going to be real financial impact for businesses. That financial impact will manifest in retention of talent, turnover of talent for companies that are either located in states that have restricted access to these services, where those employees can relocate out of the states. They're going to lose talent that way. Where companies are in those same states saying, don't worry, we've got your back if you need access to reproductive health services. Again, those companies will have a higher likelihood of attracting talent, so they'll be more successful in their recruitment efforts. They'll have a more loyal workforce, and they'll retain that talent over time. So we see a strong business case for why companies really should be proactively thinking about putting statements out, and you don't have to put a public statement out, but putting a statement out in support of your workforce, recognizing this is a labor and economic issue, and then putting the benefits in place that can support those workers. So let's just kind of step back for a moment and say, well, what is reproductive health, right? What exactly are we talking about here? I think this is an important moment for us to really reframe this issue. So many companies and business leaders have said, "Ooh, abortion, that's a fraught topic. And that's super politically charged. I don't want to touch it." Well, okay, but let's frame it as reproductive health, right? Which is a full range of services. But according to the World Health Organization's definition, having access to reproductive health ultimately means having the capability to reproduce and the freedom to decide if, when, and how often to do so. So the fact that we now live in a country where, depending upon what state you are located in, you no longer have access to reproductive health freedoms and choice, really sets the United States apart from certainly all other industrialized nations and many other nations around the globe that have recognized this is really a core basic human right, and certainly a core basic labor right. Michelle, your webinar series is called The Equity Pursuit, and I wanted us to really dig in on some important data and an important component of reproductive health as it relates to race equity and worker equity. And that is some of the really staggering information about reproductive health and Black women. So, Black women are 3 to 4 times more likely to die from pregnancy related causes in the United States compared to white women. Um, Black maternal mortality is worse today than it was 25 years ago in the US. Black babies are 2 times more likely to die than white babies in the United States. And you can even disaggregate different factors in trying to understand why is this happening, right? So again, kind of staggeringly, a Black woman with an advanced college or graduate degree in the United States is more likely to lose her baby than a white woman in the United States who has only attained an 8th grade level of education. So that really kind of separates out, okay, it's not about education and socioeconomic status to some degree. The last stat I want to highlight, there were 50,000 preventable near-death experiences of pregnant women in the United States last year. That figure has climbed 200% since 1993. And the majority of those women who nearly died as a result of a complication of their pregnancy, the majority of those women are Black women. So when we talk about reproductive health access in the United States, we really need to think about the fact that this has an outsized impact on women of color, and it's really a life or death issue in the United States. And for folks who aren't thinking about that, you talk about a near-death experience. These are women who miscarry, who hemorrhage, who come very close to bleeding to death during pregnancy, which is totally preventable with appropriate prenatal care. And yeah, I mean, Michelle, the stats are like horrifying. It's actually really hard to talk about. There hasn't been a lot of research on this topic. There's been more and more these last couple of years, but when researchers try to unpack, okay, why is this happening? Why does this pattern persist in the United States? Not only why does it persist, why is it getting worse? The data shows it's typically because of underlying health conditions of women prior to pregnancy. There are a overwhelming number of examples of patients going to their OBGYNs and saying, hey, I don't feel well. I think I'm having complications. I'm not sure if I'm having a healthy pregnancy, and being ignored. And there's an example of this, Serena Williams, arguably the greatest athlete of all time, the greatest female athlete of all time. She nearly hemorrhaged to death after giving birth a couple of years ago. She had to beg her doctors, saying over and over again, I have had blood clots in my lungs before, and I think I'm having it again. They ignored her for I think 24 hours, and she nearly died. So it's all women of color who are not being listened to by their medical caregivers. But when you unpack that further, really the root cause is this systemic societal racism, which, decades and decades, centuries of history and legacy in the United States, but you really see it manifest in the health and care and well-being of women of color. And, I really want to kind of hone in on that because, let's pull the aperture back out again, okay, and think about this again, reproductive health in the business context. Corporate America has been relatively quiet on this issue. So only 4 out of 10 companies have said that they are going to make any kind of internal statement or think about putting policies in place. And about just as many companies are taking kind of a wait and see approach to this topic. But these are the same companies that in the summer of 2020, during the Black Lives Matters movement protest around George Floyd's murder, these were the same companies that put out declarative statements that all Black lives matter. And so Oops, I'm sorry. My screen just switched. Let me pull you back up. Um, but these are the same companies that if you work for one of these organizations that again put out statements that focus really on Black Lives Matters, this is the next moment for them to really put support behind an issue that has such an outsized impact on women of color. So going back to that moment in early May when we, found out with real clarity just how robust the Supreme Court's position was going to be in reversing access to reproductive health care for women in the United States, our team at Gender Ideal decided to take our anger, our kind of heartbrokenness and try to take it to action, put it to action. And so we began a process of putting a playbook together to provide step-by-step guidance to companies on how they can protect the reproductive access for their own workforce. And so this manifested into protectreproductivehealth.org and the the ProRepro playbook, which we launched on June 24th when that ruling came down. And again, we had kind of dozens of heads of HR and people managers provide input, benefits administrators, third-party benefits platforms and insurers. We consulted with employment attorneys and additional benefits platforms to help create and figure out what the combination of actions and benefits are that a company should take to support its workforce. And I should say, one of the things I've really been struck by is that right after the ruling dropped, a lot of major US brands put out these statements that they would be offering travel reimbursement for their workers. But when you really unpack, well, how are they doing that? And who is that actually accessible for? There are still huge swaths of the workforce at those companies that put those public statements out. And I would say the most vulnerable workers at those companies, right, who are not going to be covered by those benefits. That includes workers who are not on the benefits plan, who might be part-time workers, or who could not afford the benefits plan, which is a very commonly cited reason that employees cite when asked why they're not on their company's benefits plan, that it's too expensive. And so here again, we're in the cycle of like reinforcing, oh, you don't have enough money to qualify. You don't work enough hours because you have caregiver responsibilities. Well, that's too bad you don't get this benefit. We've really tried to unpack what it is that a company can do to ensure that these benefits are equally accessible to their whole workforce. So first, let's just think about the process that a company should go through. Number one, you've got to have a leadership alignment around, yes, this matters to our company. We believe this is a worker and race equity issue, and we will be putting the appropriate benefits in place. Right? You want to have your C-suite aligned, you want your HR people team, you need your finance department all bought in. And I would just note, if going through that process, it becomes clear that there are individuals who do not share the same commitment to having or providing access to reproductive health services for their workforce, it is totally appropriate to and should be encouraged to allow people to kind of opt out of this process. If they are in a leadership role, but just can't get there based on their own values, thank them for their clarity around not being aligned, and they don't need to be part of the process. And so make sure that that core team is really aligned and committed to this issue. And that's super important as we come later to some of the issues around data protection, privacy of information, confidentiality, right? We don't need people involved who are not totally believing in and committed to the cause. But also, I think we need to acknowledge that there are individuals who might personally not want to take advantage of the full range of reproductive health services for themselves as an individual, right? They may not want to seek an abortion, but it also doesn't need to prevent them from recognizing that that personal opinion still doesn't necessarily need to preclude the ability for others, given their own individual situations and circumstances to need access to these benefits. But again, I just want to highlight, making sure there's true buy-in, and if there's not, rejiggering the group that's going to be leading these efforts internally is totally appropriate and encouraged. Once you've got that leadership alignment and commitment that yes, we're going to add benefits in to protect the reproductive health access of our workforce, then then this really becomes an issue of researching what those benefits are that can be added, what the cost of those benefits are, as well as what the benefit is. In our Repro playbook, we have added in a cost benefit worksheet calculator where you can estimate different levels of benefit services for each of the 7 benefits that we provide. And you can calculate the cost, and then you can also calculate the benefit, the savings in lower employee turnover, a more committed and productive workforce, and lower retention costs. Once you've done that research and have kind of narrowed in on a range of different options of benefits, then you go through that decision-making process where you've got your budget team in and you say, okay, well, how much might we end up spending on this? So what can we allocate? Which of the various benefits options should we go for? And once you've made those decisions, then you get to this, again, very important step, which is focusing on the implementation of these benefits and how you're communicating to your workforce how they access and can take advantage of these benefits, right? There's a ton of sensitivity around this, right? If employees are told, hey, just email HR and tell them that you need to travel out of state for an abortion, it is very unlikely that employees are going to feel comfortable doing that. That's a highly sensitive information and experience. But if you can say, here's the third party administrator that's administering these benefits, and here's how you contact them, far more likely to have employees and their immediate family members take advantage of these benefits as needed.
Flory, I have a question. So I like the third party where nobody is aware in the specific employer what you're doing. Have you had employers who are like, well, only 30% of our employees identify as women or able to birth children? How then are you able to say it's not just for those individuals in your organization?
Right. Yeah. I mean, there's a strong precedent of, at least for employees that are on a benefits plan, to have access to those benefits coverage for their dependents. The definition that we use in the playbook is access to these benefits for all employees and their immediate family members. So that generally is defined as people who live in the household. And in the cost benefit calculator, we provide guidance. So you should assume any woman or woman identifying employee who is between the ages of 15 and 45 is of childbearing age. And then we provide calculators to estimate, for the number of dependents across your whole workforce and in their households, how many individuals you really might be covering with these reimbursements. We also include calculations around, the percentage of women, including those dependents in a given year who might find themselves pregnant and who might need to take advantage of these benefits. So we do try to really kind of unpack and get to specific numbers, how many people should be covered, and then how many people are actually potentially going to be taking advantage of these benefits. So companies can really, estimate that true cost with a pretty good degree of accuracy.
Okay, great. Thank you for that.
Yeah. So I'm going to run through, especially these first couple of benefits pretty quickly. This first one is providing paid sick leave. It's kind of staggering that in America, and especially in a country right now where we are led by a majority of legislators who are pro-life, that we don't have paid sick leave, right? If you're pro-life, then you should recognize the fact that when workers are sick, they need to be able to stay home to take care of themselves or to take care of dependents in a steady state environment. But unfortunately, many U.S. workers do not actually have access to paid sick leave, and especially those workers who are hourly workers who work in retail, hospitality, restaurant. Those are the workers who are kind of least likely to have access to paid sick leave, but again, really most in need of it. And so again, our cost benefit calculator provides guidance on what a good paid sick leave policy is, what a better one is, and what a best one is. We also have provided data on actual usage of paid sick leave, right? And so you can calculate the cost. But of course, if you have an employee who is dealing with a reproductive health emergency, whether it's for herself or him caring for a partner, knowing that you can take the time you need to access the reproductive health services you need is really critical. And again, the second one, we are the only industrialized country in the world that does not have a federal policy around paid family leave. But again, if we are a pro-life society, well, then shouldn't we be ensuring that not just birth-giving mothers, but also parents who are expanding their families due to adoption, surrogacy, and all parents, regardless of gender, should have that time to bond with and to care for their new family members. So we strongly encourage companies to provide paid family leave. And we recognize, this is one where the potential cost can feel overwhelming for a company. But I think when you really calculate the number of employees inside of an organization that might take advantage of a paid family leave and what the actual cost is, and then you offset that with the fact that data shows those same workers who have access to paid family leave are far more loyal, stay with their employers, feel a deep commitment to the organization, it really does pay off in dividends over the long run. The third benefit is emergency assistance programs. And we included this in the Repro playbook because we had an expectation that candidly has not yet played out around the role of emergency assistance programs in a post-Roe environment where, again, without access to the full range of reproductive health services, you really can have a reproductive health crisis. Emergency assistance programs generally are a benefit accessible to all employees and their immediate family members, often tied in through short-term disability programs, but also can be associated with a general health coverage policy. And the concept behind an emergency assistance program is if an employee is having a crisis or if their family member is having a crisis that's impairing their ability to do their job, EAPs are available to step in. Historically, that definition has really focused on whether it is a financial crisis, a substance abuse crisis, another kind of legal crisis. But again, when you kind of think about that definition, it would seem logically that EAPs would also be available to provide kind of immediate services and options to an employee if they're dealing with a reproductive health crisis. That said, I connected earlier this week with one of the benefits administrators who helped us put the Repro playbook together. And she said that she's really been quite surprised and disappointed to some degree that the EAPs her company works with have said they're not actually planning on doing anything differently despite this ruling. And so I flagged this as something that if you're joining this conversation, ask your benefits administrators, hey, what is our EAP doing to provide emergency assistance in a reproductive healthcare crisis? Because it's something that I think we can nudge and shift the expectation and definition of what an EAP should support over time. Benefit number 4, comprehensive health coverage. Okay, now we're going to get into where this gets a little bit more complicated. And I would say comprehensive health coverage, travel reimbursement, and emergency funds, which are benefits 4, 5, and 6, all begin to get a little bit interrelated. So I'll explain what I mean by that. So ensuring that all of your workers have access to comprehensive health coverage, which includes full coverage reimbursement of all contraceptive care, right? So preventing pregnancies from happening is step number 1 and critically important, and was something that was included in the ACA as a requirement for most health insurances to cover, but it's a good starting point for HR teams to reach out to their benefits administrators and just ensure that all of their health policies include access to comprehensive contraceptive care. That's step number one. Step number two, now I'm going to start talking about travel reimbursement. And I apologize, I'm going to get a little bit wonky here, but there are two ways that employers get health coverage for their workers. The first, and this tends to be for smaller companies that have fewer than 300 employees, is health insurance plans that are fully insured. What that means is the state provides coverage of all of the, the state provides reimbursement for coverage of all of the care provided or defined by that health plan. The employer pays a fixed rate per employee or per dependent under a fully insured plan. And that's really nice for smaller employers because they know exactly how much they're going to pay for their health insurance coverage in the coming year. The limitation around a fully insured health plan is that the items that are covered in those fully insured health plans are dictated by the state. And so in states now that are restricting access to reproductive health care services, fully insured health plans in those states will be likely stripping out access to reproductive services, including abortion. And of course, I'll just footnote that for 35 states in the country, any people who are on Medicaid, right, and those are the folks who are kind of at the lowest income thresholds, Medicaid coverage in 35 states has not covered abortion services thanks to the Hyde Amendment. And there are only 15 states today that through those state-run Medicaid programs do provide access to abortion services. So the kind of fully insured plans, it becomes very kind of subject to what states you're in to determine whether or not your employees will have access to reproductive health care. But we've got a solution for that. But let me just say the second type of health insurance plan is called a self-insured plan. These are plans that tend to be used by larger employers that have 300 or more employees, where the company is self-insuring their plan. And as a result, they can dictate what kinds of procedures are covered. They get to define the plan. And very importantly, though, these self-insured plans are covered by federal law, ERISA law. And so these self-insured plans will not be subject to the same restrictions on coverage that state-run plans will. So any self-insured plan will be should be providing coverage to the full range of reproductive health services. So if you work for an employer that's a larger employer that has a self-insured plan, they should be able to, there are no limits for them in covering and reimbursing for abortion services. They also have no restrictions or limits on covering travel reimbursement if you need to travel beyond 100 miles or travel out of state to access reproductive health care services. Back to those smaller fully insured plans, there is a workaround. If you are in a state where those state-determined plans or state-defined plans do not cover abortion services, then what an employer can do is they can layer on top of their health insurance plan something called a health reimbursement agreement, HRA, health reimbursement agreement, where they can add on additional benefits. Many companies have been doing this. So companies that provide fertility benefits to workers, oftentimes that will be through an HRA. So this is a great workaround to make sure that access to abortion services and the travel reimbursement can be covered by your health insurance plan and accessible to all of the employees who are on your benefits plan. But there are limits, right? What about those employees who have opted out of the benefits plans for whatever reason? Maybe the benefits plan was too expensive. We've got some alternative approaches on the benefits plan. And Michelle, I'm just noticing there. Thank you so much. I see my slide again. So the workaround, and actually, before I talk about the workarounds, we should note, and there has not been nearly enough coverage of this, the HRA and the health insurance and travel reimbursements are subject to IRS reimbursement limitations. The IRS caps lodging reimbursement, so the cost of a hotel, $50 a night. I don't know when I stayed in a $50 a night hotel. But for most people traveling, they are going to end up spending more than $50 for their lodging. And yet they will only, through their health insurance plan, be reimbursed $50. Same thing on mileage. If you have to drive 1,000 miles to get to the border of Illinois to go to a clinic, you today, I think it's a reimbursement. They just upped the mileage reimbursement, I think, to 22 cents per mile from, I think, 18 or 16 cents per mile. But it still does not cover, given the cost of gas today, the full cost of traveling. So again, a lot of companies are saying, hey, we're going to do this travel reimbursement. We'll cover up to $4,000. They're going to hit limits. And so then the question we need to be asking those employers is, what workarounds are you putting in place to really pay the full cost for your employees? So here's where we're going to provide some alternative approaches. Beyond providing those benefits to folks who are using your benefits plan, your health insurance plan, and through the HRAs, companies can also put into their corporate travel plans, or excuse me, corporate travel policies, a statement that says we will also reimburse for any travel related to accessing reproductive health services. If they want to include a more expansive definition beyond reproductive health services and say any required medical procedures that involve travel, you can use as expansive or as narrow a definition as you are comfortable with. And then the way that should be administered, again, is through a third party. So if your company has a third party corporate travel platform that manages reimbursements, let them know we're going to start reimbursing for these medical related travel needs, and accept those receipts. And you need to have, again, put thought into how that type of travel should be approved. Call Karen in HR if you believe you need approval for medical related travel. Do not email. We do not want any paper trails. This should not, it should trigger, third party data compliance through that third party administrator. If it's through the health plans, it's HIPAA compliant. So people cannot be asking for these records and this data. But you really do not want to have any record of the instances in which these benefits may be requested by your employees. So that corporate travel reimbursement is a workaround for any employees that are not on your benefits plan. But this still doesn't address another issue. And again, this is the issue for our most vulnerable colleagues who have the probably lowest income jobs inside of an organization, and who, and this is not a fringe, this is 6 out of 10 workers, do not have enough savings to cover an unexpected medical cost. So don't have savings in their checking or savings account of greater than $500. And so the issue here is, what about those out-of-pocket costs that they're going to incur? It's great that you'll get reimbursed, but an average abortion, depending upon how far along the pregnancy is, can cost anywhere from $400 up to $1,500 or more. Travel costs obviously require upfront payment. So how is your company getting money into the hands of people who need these services quickly so that they can quickly access them? And this is where we've had conversations with a number of benefits platforms that are, as we speak, putting together new products for companies to put into place these emergency funds programs. And I'll just note, a number of these companies are relatively new and actually were started during the pandemic, when we saw a big surge in COVID relief funds that employers wanted to offer to their employees. And so the idea is, these emergency funds, they can be funded by the employer, they can be funded by the employer, and other employees can put donations in. And if an employee needs access to these funds, they go to the third party platform and they say, I need access to funds for whatever reason. If they click a box that says for medical purposes, no more questions are asked. Now, some companies are putting these emergency funds into place as a kind of a general health and wellness fund. Hey, we'll reimburse any employee up to $1,000 for health and wellness related fees. Now, if you check the box that says, I need reimbursement for my gym, it's going to ask you for receipts. But the moment you check that box that says, I need reimbursement or I need advance funds for medical services, no more questions are asked. And these platforms already have the linkages connected with your payroll system so they can immediately deploy funds into a bank account. And that person can move forward accessing whatever services that they need. So this is a really important service that companies should be thinking about offering. I mean, in some ways, I think this emergency fund access, if they can do it up to $4,000 or $5,000, and maybe you can't do some of the other benefits, but provide this alone, making sure you can get money into people's pockets as quickly as they need it, is probably hands down the most important benefit. I'm heartened because these platforms that I've been talking to, and I'll give a shout out to one, Canary, though I know many others are also putting these products together. They've been approached by numerous new companies, new potential clients for a product like this. But I certainly hope more and more companies will go this route to support their most vulnerable workforces. And the seventh benefit is a relocation or remote work benefit for employees who are based in states that have now restricted their access or soon will be restricting their access to reproductive health services. If employers can offer to those employees, hey, you can relocate, you can move to another state where our workforce is already located, that provides the flexibility that many workers are and the data shows, are currently seeking out. Obviously, again, when it comes to those hourly jobs, the retail, the hospitality jobs, you can't do those jobs remotely. And so for those companies that can't offer this relocation benefit, takes me back to benefit number 6 and number 5 and numbers 1 and 2, provide those benefits to your workforce, given that they can't be so flexible in where they're doing their jobs from. Beyond all of those benefits, we've got these additional actions. And thanks, Michelle, for making this a little bit bigger. Create a corporate policy that says you will no longer hold corporate events or attend conferences in states that are limiting access to reproductive health services. This was incredibly effective a number of years ago when North Carolina introduced the gender bathroom ban, right? I believe the NCAA March Madness pulled out of the state, and many other companies that had events planned, they're also pulled out. And when lawmakers feel the real economic impact for their local economies and their businesses, they are less likely to put restrictive, harmful policies like this in place. Ask your company to review all of their political giving, right? After Citizens United came down, more than 15 years ago now, corporate political giving has had a huge outsized impact in our political process. Ask your companies to review and be transparent about what politicians and what PACs they're giving money to, and whether those PACs are anti-reproductive health, and then ask them to stop giving those donations. That can have a huge impact. And there are a number of additional actions that we include in the playbook and on this slide. And with that, I will pause. I think Michelle, I may have missed a question that came in through LinkedIn.
So it's long, so I wanted us to come back, and actually I can only read part of it over here, and so then LinkedIn wanted to be slow uploading it, so I was going in and out of the app. So I'll show it on screen. I don't think it's not going to show all of it, but we'll start and I'll read the rest from my screen over here. But it goes. These conversations should have been happening long ago about disparities in healthcare for Black women. And you and I had this discussion last month or earlier this month. I can't remember. The summer's running together. But there was silence because all women were simply not concerned or aware. Yeah. This issue is now just a talking point to use in order for non-Black women to get their reproductive freedoms back. There are no SMART goals to change the issue for Black women. Instead, we're talking about just trying to fix the issues that affect all women. If we're going to use Black women as an example, give me one sec. As an example, if we're going to use Black women as an example to exploit, maybe we should be offering direct solutions for those employees' healthcare needs. I hope that in the future, this attitude of only caring about when it affects non-Blacks changes. And I would like to hear more about your approach to solving that.
Yeah. I don't feel like I have a great solution. I'll be really candid. I think where I see my own opportunity is as a white woman to be educating other white women on these facts. And so instead of, I'm going to go down a little bit of a sidetrack here, but I think it's relevant. If you listen to the New York Times, they have a podcast called The Daily every day, and they've been doing a really good job of providing kind of real world examples of women who suffer miscarriages, but because a miscarriage is not, the care for a miscarriage is an abortion. And in states like Texas, they've got these very powerful examples of how women, 9 months ago would go to a hospital and the miscarriage could be accelerated and terminated, and now they're kind of suffering for weeks. I mention this because the women they've been profiling on The Daily are white women, and so I think it becomes very real for people like me, right? Who, I can identify with that. And that is both helpful and also insufficient in, to your point, flagging these additional issues that primarily impact women of color around health equity issues. And so I would love, I don't know who the person is that wrote in this question, if they have thoughts on ways that we can surface this more prominently to address a range of issues. I am open to that. I agree. It's incredibly important. I don't have the answers, except that I will try to use my platform to surface this. And again, as it relates to this issue of what are businesses doing, well, I think a lot of these businesses like Amazon have gotten credit for putting their travel reimbursement policy out. It doesn't cover anyone who's an Amazon driver. It doesn't cover the hundreds of thousands of employees they have in the United States who are kind of piecemeal workers and not on the benefits plan. So, that's where, if we can elevate this issue, I hope that we can have some, impact on it. But I'm open to your, comments and guidance.
So Flory, there are quite a few now, I would say in the last 5 years, of healthcare tech startups that are focused specifically on Black and Brown women's healthcare. A friend of mine here in South Carolina had started one back in 2014, 2015, after she had lost 2 infants. And after going through that, and even one of my sisters having had a NICU baby as well, her and her best friend at the same time had newborns in NICU. And so that trauma, as you see, as we talked about, prior to it would be, the passing, it would not have made as much headline. And one of the reasons we're bringing one in the Black women's statistics is it is not known, and how this change with Roe versus Wade really impacts Black women. And for employers to say, we're for our Black employees, you have to show up and utilize whether the current status of what you have in your healthcare plans or change your healthcare plans as well. And so I do a lot of pushback with employers when I talk to them and say, our employees love our healthcare plans. I say, well, which ones don't? And they always look at me, because if you're talking about equity, if you're talking about bringing about change for your Black employees, oftentimes they're the margin. And in my mind, I'm seeing a regression line. And you see all the little dots along the regression line. What are the dots that are furthest from the regression line? Yeah. Those are the people you really need to be focused on. And so the comment is coming from one like, hey, we're talking about an approach to talk about everybody along those lines, but it's really not touching on how does it help those women that historically healthcare has not been studied. They don't have enough doctors who can identify with what they're going through. And even can they go through your current medical plans to not go to doctors, but actually having doulas that
Mhm.
truly have a better, actually have a better life expectancy for the mother, a Black mother, if she has a Black woman doula. And so those things, I think, speaking more specifically for Black women, like what does that look like? And so there are Black doula communities, there are Black moms, maternal health communities that have been trying separately to do this work. But I think this is an opportunity to see what they can bring in and how they can say, hey, this won't, this we've seen this and this doesn't help for
Right.
this community. And that's really the opportunity right now. I see of bridging what happens between what you're proposing and what they've been doing for the last 25, 30 years in those spaces.
Yeah. Well, and that, I think that example of the doula, I mean, when we think about, okay, how do we take that and make that a practice that employers are supporting? That's something that we can add into these emergency funds. Hey, make this an emergency fund that's providing benefit and coverage, reimbursement for a range of reproductive services, including doula services, right, for pregnant women who are giving birth. Like, how can we normalize mainstream and make this more supportive through the lens of what an employer can do? I think I hadn't thought of that, and I think that's something we can and will add into the Pro Repro playbook as an example.
So I would say that partnership or even letting those other organizations lead some of this would help actually improve the maternal health for Black women, especially. So, because the states most impacted have a high percentage of Black residents and citizens. And I know one of the slides was relocation and remote work. And culturally speaking, when you have kids, you're trying to stay within your community, you're trying to stay within your village lots of times.
Right.
And so that option may be viable for some women, but they're like, now I have to be with them all day, every day.
Right.
And so it's something extra to bring in. And so where do we find things culturally that also works for communities of color?
Yeah. Yeah. I think that's a great point. And yes, we will add those topics and highlight them in the playbook going forward. It's a great point.
I want to connect you with Jessica Walker. She's been doing Black women's maternal health work out in California. I don't know how many years. She's a mom of 6. No multiple births, but a mom of 6. And she couldn't join us today, but I think she'd be a great person to connect with to understand what's also going on in that space as well. So I'd love to make that connection.
Yeah,
as well.
I would appreciate that. She sounds like a great resource.
Any final thoughts as we wrap up today?
Not from me. I just thank you for this opportunity to talk about the playbook. I appreciate your feedback. I appreciate these questions. I guess the last thing I would say is we will be making revisions to the playbook every 2 months as more examples come out, different approaches that companies are using. We will share them. We will add the resources in and make revisions. So I think some of these kind of additional perspectives and lenses that we should be embedding into the playbook benefits are things that we will certainly be adding and improving over time. So thank you.
So thank you, Flory, for joining us. Everybody be sure to connect with Flory. Where's a good place to connect with you if they're looking for more? Just the Gender Ideal website.
Yeah, you can go to gender-ideal.org, or if you want to download the playbook, go to protectreproductivehealth.org, and you can download the playbook there, and we'll make sure that you get updates to the playbook over time.
All right. Thank you so much, Flory. Everybody have a great day, and we will be back in about 2 weeks with our next discussion for the equity pursuit. Bye, everybody.
Thank you. Bye-bye.